Amy, when it comes to benefit programs, there's a lot of challenges that employers face, and they're multifaceted. Let's take healthcare, for example. You know, employers really are trying to use their healthcare benefit programs as a strategy to attract and retain talented people, but it's not without certain issues to address. You have rising medical and pharmacy costs. You have challenging engagement when it comes to wellness and clinical programs that employers are invested in. We're trying to do a lot of innovation, putting tools in people's hands, you know, coming up with new network strategies. Really, a lot of challenges there, but it doesn't stop there, does it? Compliance is certainly an important issue to be focused on, and would like to hear some of your thoughts around compliance, particularly with the prospect of some pretty significant reform ahead of us.
Well, Greg, the ACA has been a compliance challenge for employers for sure, but it's not going away immediately or all at once. And so that challenge will remain for employers. And many of the types of things you mentioned also raise compliance issues. There are huge risks for employers around compliance. There are the risks of government audits, which we do expect will continue. There are the risks of lawsuits from employees and retirees. There are public relations risks, and even internal audit and internal investigations can be troublesome. So there are many risks facing employers around those compliance issues, and as I mentioned, they're not limited to ACA. So a couple of examples. We've seen a slew of COBRA notice lawsuits recently, which can impose huge fines on employers. In another area, you mentioned the network strategies. Providers are coming back to employers to recover payments if they are out of network. And more out-of-network providers means more and more of these benefit appeals. And employers that don't have a compliant process around this leave themselves open to huge risks.
So you've articulated a lot of different issues and things to be thinking about there. Can you talk a little bit about a framework that an employer can think about to really address these various issues from a compliance standpoint?
Sure. At a high level, to the extent that an employer has a holistic type of compliance program, making sure that the health and welfare benefits are included in that compliance and governance process is really important, so that there's streamlining of processes and accountability that makes sense throughout the organization. Secondly, be prepared. So whatever you're doing in the health plan space, whether it's plan design, network strategy, cost controls, wellness programs, that compliance is part of that and embedded into all the work streams of design, implementation, and execution.
A lot of good thoughts there, and obviously, you know, even with the prospect of significant healthcare reform ahead, it's a good time, it seems like, for employers to be thinking about compliance and how they're structured and ready to address it so that they can deal with these new issues that are in front of us. Thanks for the time, Amy.
Thanks, Greg.